A very good afternoon to all our viewers today. I am Dr. Anushka from Gleneagles Hospital, and today we have with us Dr. Meghra Jingle. Very good afternoon, sir.
Good afternoon.
Welcome to our Facebook Live today. So, let me give you a quick introduction about Dr. Meghra Jingle. Dr. Meghra Jingle is the Director Clinical Gastroenterology at Gleneagles Hospitals, Mumbai. He has been practicing since 2010 and has a rich academic background. His special interests include ERCP, enteral stenting, diagnostic and therapeutic endoscopic ultrasound, third space endoscopy, capsule endoscopy, and cholangioscopy. Dr. Ingle is a highly skilled and experienced gastroenterologist with a passion for providing his patients with the best possible care. He is a member of several national and international medical societies and is regularly invited to speak at conferences and workshops. He has published over 50 scientific articles in peer reviewed journals. A very good afternoon, sir,
Good
and
afternoon.
welcome to our Facebook Live session today. Very good to have you here with us. So, let's move on to today's topic.
Sure.
Our topic today is about bowel diseases.
Okay.
So, let's know more about what exactly are bowel diseases.
Bowel diseases is a term which is used to diseases or condition that affect the intestines, especially
Mhm.
the large and the small intestines, and these are the intestines which are involved in the digestive process of our body. And so anything affecting, so beyond the stomach, anything that is affecting the digestive tract is what we call as bowel diseases or bowel disorders.
Okay. And why are these diseases caused?
So the exact cause of many of these diseases is not known,
Okay.
but then certain factors like environmental factors,
Mhm.
like urbanization,
Mhm.
urban lifestyle, urban eating habits are known to more predisposed to bowel disorders. Then certain genetic factors, like if you have a family history of certain bowel disorders, you are more likely to develop bowel disorders. Then your food habits. So a lot of fatty foods, spicy food can cause bowel disorders. Certain type of bowel disorders are related to intolerances, like celiac disease, for example, is related to wheat intolerance. So they
Mhm.
can also be a causative factor for bowel disorders. Stress is one of the common causative factor for development of bowel symptoms of bowel diseases.
Okay. So, as we heard about many multiple causes, are there different types of bowel diseases?
Yes, there are various types of bowel disorders.
Mm-hmm.
Broadly, they can be classified as irritable bowel syndrome,
Okay.
which is basically a functional disorder where structurally there is nothing wrong with the intestine, there is no inflammation, but these patients have a lot of symptoms. The next will be inflammatory bowel disease. It sounds very similar. It's called IBD, where there is active inflammation going on in the small and the large intestine. It has got
Okay.
two variations: ulcerative colitis and Crohn's disease.
Okay.
These patients are generally sicker
Mm-hmm.
with the abdominal pain, weight loss, and they also sometimes have blood in the stools.
Okay.
Other variation is what is a diverticular disease, more common in elderly, where the large intestine over a period of time develops certain outpouchings or pockets in the wall, and these pockets get inflamed because of food or residue getting stuck, and then they develop inflammation, pain, sometimes bleeding. And then, as I said, sometimes food intolerances like celiac disease is
Mm-hmm.
also one of the types of or wheat intolerance or gluten intolerance as it is called
Mm-hmm.
is also one of the types of bowel diseases or bowel syndromes.
Okay. So, what are the symptoms of all these diseases?
Most of these patients will complain of abdominal pain or discomfort,
Mm-hmm.
uh, altered bowel habits, either constipation or diarrhea,
Okay.
bloating, excessive gas formation,
Mm-hmm.
and in inflammatory conditions, they will also complain of weight loss. They will have malabsorption of the various nutrients, and
Mm-hmm.
sometimes passage of blood in the stools can
Mm-hmm.
also be the presenting symptoms of these
Okay.
conditions.
Okay. So, as we spoke about multiple intolerances, so does diet really affect
Oh yes, diet plays
diseases?
a big role in in the causative factor and also in the exacerbation or causing of flare-ups.
Okay.
Like for example, if you have inflammatory bowel disease, so in that case, a high fiber diet or high fatty diet or high spicy food can actually exacerbate your symptoms and
Okay.
can cause worsening of the symptoms. If you have irritable bowel syndrome, which is a functional condition, then certain foods which are called as high FODMAP foods.
Okay.
FODMAP means it's fructose oligodisaccharide rich foods.
Okay.
So these are foods like garlic, onion, and certain types of vegetables like cabbage. So when they are digested, they tend to produce this chemical compound that is fructose oligodisaccharide, which produces more gas formation when it reaches the large intestine.
Okay.
So in these symptoms, these patients, if they consume these type of foods, they will have a lot of bloating, gastric discomfort, change in the bowel habits. So this so food does play a part. Caffeine,
Mm-hmm.
excessive caffeine consumption is
Okay.
especially in the cities and the younger generation. We see
Mm-hmm.
there's a lot of dependence on caffeine.
Right.
You are working hard and you want to remain awake and be alert.
Mm.
Caffeine is one of the important causes of development of bowel symptoms. So,
Balance.
and alcohol and
Mm.
smoking.
Mhm.
Smoking is a known causative factor for Crohn's disease. Alcohol over a period of time can affect the lining of the intestine and
Mhm.
can affect the motility and the absorption of the intestine.
Okay.
So
So,
these food
mhm.
items or these things we should be a little careful about.
Okay. Right. So, how do we know what kind of bowel disease we have? How do we diagnose it?
Yeah. So see, diagnosing of bowel disease first is based on the history that
Mm-hmm.
you give to your healthcare provider or to your doctor
Okay.
of the various symptoms. Then is the examination. If you're on examination, you are reasonably okay, healthy, you are probably dealing with the inflammatory bowel, you are dealing with the irritable bowel syndrome or
Mm-hmm.
IBS. However, if you appear to be sicker, you have lost muscle, you have lost weight, you are pale, means you lost blood, you are probably dealing with an inflammatory condition.
Okay.
So history, whether there is passage of blood or not, or there is bloating, whether there is weight loss, whether the symptoms affect your night sleep,
Mm-hmm.
examination, and then certain tests. So these tests
Mm-hmm.
could be simple blood tests
Okay.
for the general health, specialized tests to look at specific inflammatory markers or food intolerances are available.
Mm-hmm.
Stool test again to look for inflammation or for certain parasites or certain infection and inflammatory markers.
Okay.
And if these are not conclusive, then we do certain imaging tests like sonographies or CT scan and MRI.
Mm-hmm.
And then most commonly, the final diagnosis comes from doing an endoscopy or a
Okay.
colonoscopy, where you actually look at the intestine,
Mm-hmm.
visually inspect, and if needed, take biopsies for looking under the microscope.
Okay. So, is this disease hereditary?
Yes, to quite some extent,
Okay.
especially inflammatory bowel disease, that
Mm-hmm.
is Crohn's and ulcerative colitis, is known to be hereditary. And if you
Okay.
have a first degree relative affecting by these diseases, there is a very high possibility that you might be affected because of it.
Okay. In that case, is there any way to diagnose it early or intervene early?
Uh, Actually, if you have a family history of a particular disorder, then uh, 5 to 7 years prior to the onset in the family member, you can get yourself screened by doing certain blood tests, stool tests, and
Mm-hmm.
if needed, a colonoscopy.
Okay.
We cannot prevent the formation of the
Okay.
disease, but if detected earlier, especially inflammatory bowel disease, then you can start treatment.
Right.
And many of these conditions have long-term complications.
Okay.
At least those can be avoided or prevented in these patients. You cannot stop the occurrence, but you can
Mm-hmm.
detect early so that long-term complications can be avoided.
All right. Are there any parameters which impact bowel diseases?
Uh, by parameters, you mean the
Like stress or something like
oh
that?
yes, external parameters very much. So
Yes.
stress is one of the biggest parameter that
Mm-hmm.
affects. So stress. Okay, so we'll take one after the other. So
All right.
stress is very important. In irritable bowel syndrome, stress plays a major role
Okay.
in affecting the gut motility and sensitivity,
Okay.
and these patients tend to have a lot of symptoms. And many
Mhm.
times, patients are advised de-stressing mechanisms like meditation, yoga, or in fact, even put on de-stressing medications.
Okay.
In inflammatory bowel disease, stress can cause more inflammation and cause more bleeding or more increased stool frequency in these patients. The second is exercise.
Mm.
We all know that exercise is useful, healthy for your heart and your muscles and your joints. But seldom do people know that exercising is also useful for your bowel health.
Okay.
If you
Interesting.
exercise, yeah, not many people are aware of this, that if you have an active healthy lifestyle, and if you exercise regularly, your bowel functioning is also optimal. The frequency of your bowel movements is better. There is less chance of any inflammation happening, and complaints of bloating and abdominal discomfort reduces.
Okay.
Also, indirectly, exercises helps you to reduce stress,
Mm-hmm.
and we know that stress can aggravate bowel symptoms. So
Right.
exercise directly and indirectly by reducing stress helps
Mm-hmm.
us to reduce. So if you
Mm-hmm.
take care of these external factors, probably you can probably control your bowel symptoms better.
Okay. There are a lot of patients who complain about bloating very regularly.
Yeah.
So, would there be a higher susceptibility of them, having a long-term irritable bowel disease
Yes.
or
So in
something?
patients who complain a lot of bloating, many of these have an overlap with the
Okay.
irritable bowel syndrome,
Mm-hmm.
IBS. And as I said, part of it is because the excessive gas production causes too much of distension,
Hmm.
and their gut is a little sensitive, so they tend to feel the pressure more than what a
Hmm.
normal person would feel.
Okay. Do children as well develop this kind of a disease?
Children generally don't develop irritable bowel syndrome.
Mm-hmm.
It's a disease that comes in early adulthood or adulthood. But
Okay.
yes, children can develop inflammatory bowel disease, especially
Mm-hmm.
Crohn's disease. We are seeing more and more children being affected by that. And children can also develop food intolerances like celiac
Mm-hmm.
disease or gluten sensitivity, as because it is a genetically predisposed
Mm-hmm.
condition, can manifest itself in children, and we very frequently see children getting affected by these conditions.
Okay. So, as we heard that this disease is like a long-term
Hmm.
thing, can it be cured completely?
Most of these diseases cannot be completely cured.
Okay.
They can just be controlled and kept under check.
Mm-hmm.
And certain conditions like inflammatory bowel disease or celiac require lifelong maintenance therapy or lifelong dietary changes to keep the disease under check. But
Okay.
they cannot be cured. But yes, they can very well be kept under control, and uh,
Mm-hmm.
if the patient follows the instructions and the uh, lifestyle changes and certain
Mm-hmm.
medication that has been advised, they can live a healthy life.
Okay. Is there any surgical intervention that could help?
Surgical intervention is helpful in a small subset of patients with inflammatory bowel disease who develop complications like change in the caliber of the intestine. The intestine has
Mm-hmm.
become very narrow, so
Mm-hmm.
inflammation happens, and then during healing, a scarring happens, and the intestine gets narrowed. To remove
Okay.
that scar, surgical intervention is required. Sometimes there
Okay.
is a connection between two bowel
Mm.
adjacent bowel organs and called
Mm.
fistula. So again, in this case, if the fistula is developed, then in these cases, surgical intervention can help.
Okay. So, do bowel diseases affect any other system of the body or any other symptom of?
Yes. So there are what we call as extra-intestinal manifestations of
Okay.
bowel diseases,
Mm-hmm.
especially in inflammatory bowel condition,
Mm-hmm.
where you can have inflammation of the skin, you can have skin lesions, you can have inflammation of the eyes,
Okay.
you can have your joints involved, that is either the
Mm-hmm.
peripheral joints or the spine,
Mm-hmm.
muscles can be involved. You can
Okay.
have manifestations of the liver.
Mm-hmm.
And sometimes these patients have a higher tendency of developing gallbladder stones.
Okay.
Kidney involvement is known in these patients,
Mm-hmm.
so they can have extra intestinal manifestations. Yes.
Okay. So, how are the what are the ways to control these extra intestinal
So
manifestations?
most of the extra-intestinal manifestations are controlled if you control the bowel disease. They
Okay.
are related to bowel
Mm-hmm.
syndrome. Very rarely, like for certain skin infections or for if you develop gallstones, you require some special attention for the bowel, for the extraintestinal manifestation. But otherwise, they respond to the primary treatment. So if you treat the bowel disease, the extra bowel symptoms will also get controlled.
Okay, so we spoke about some lifestyle changes which can help in controlling. What are those?
So yeah, so lifestyle changes first, maintaining a very physically active life. So basically, exercising goes a long way in managing your bowel symptoms. Only time when we avoid exercise is when the patient is very sick or in a flare, as you call it, we tell them to
Okay.
go slow. Otherwise, exercising helps. Then maintaining a regular sleep-wake cycle,
Okay.
ensuring good sleep. Sleep goes a long way in maintaining your bowel health. So ensuring a good at least 6 to 8 hours of sleep, regular sleep wake cycles. Food habits, as we discussed earlier, certain foods are which are known to exacerbate the symptom. They should be avoided as far as possible. Eating a lot of fruits, vegetables, and uh, uh, food, natural foods, as avoid to preservative rich foods.
Right.
Natural foods are less likely to harm your body. Uh, Incorporate if you suffer from a long prolonged condition, then certain conditions like meditation, yoga to de-stress yourself, or engaging yourself in a hobby
Okay.
is also a good lifestyle change that can help you in uh, controlling this disease. And the third is medications. Last, make sure that you take the medications for the most of the time. The medications are prescribed for a long period of time, and after some time, patients get little bored and they want to avoid medications. So,
Right.
as far as possible, try to follow the doctors or the healthcare providers' advice. So that also is a very important advice I would like to give.
Is there any correlation with bowel disease to anxiety or depression, mental
Yes.
health?
So it acts both ways. If you're too anxious person or a too competitive person or always on the edge, you will tend to have a lot of bowel symptoms. Either IBS or your IBD can get exacerbated. The second thing is if you suffer from these bowel symptoms, bowel syndromes, as we discussed, these are generally chronic conditions and they have a lot of ups and downs as come to your symptoms. So these patients sometimes get depressed
Okay.
because of the long standing nature of the disease, and
Right.
that can be a factor. So yes, these patients anxiety and depression, especially relating to the long standing nature of the disease, is very common in these patients, and many of these patients do require help from the psychological professionals to manage their anxiety and depression in
Okay.
addition to managing their bowel symptoms.
Okay. So, are there any new advancements in the treatment of bowel disease?
Oh well, a lot of advancement has come now, especially in inflammatory bowel disease. Newer molecules are available, newer drugs which can be given orally earlier. All the advanced medications used to be in the form of injections. Now
Okay.
the medications are available in the form of oral medications which can be given. They are relatively safer. The cost is relatively less, so they can now be given to our patients easily on in the clinic practice also. Also, there a lot of advancement has been made into finding the etiology of what actually causes this and into the genetics of this. And now
Okay.
people are trying to identify the gene, and probably once that is there and once we have fully understood the genetic basis, probably gene therapy can
Right.
uh, also come as a future part of treatment in these patients.
Right. Let's hope for the best
Yes,
treatments
yes,
in the future.
of course.
So, as we are saying that a long-term treatment and medications are required, are there any known side effects of these medications?
Uh, medications that are given for IBS, like for example for bloating and for pain and for diarrhea, these are generally very safe, and you can take them for a long period of time. You can take them
Okay.
as and when required, and the doses, of course, prescribed by the doctor. They generally don't have side effects.
Okay.
However, medicines that are prescribed for inflammatory bowel disease, for inflammatory conditions. These are generally medicines that are given to suppress your immunity and suppress the inflammation so that the
Right.
body doesn't react to the
Hmm.
intestines. They can have certain side effects like
Okay.
development of rash in the body, development of your blood count can occasionally go low, or development of secondary infections,
Hmm.
especially tuberculosis,
Okay.
can be done, can happen
Hmm.
in these with these patients with these
Hmm.
medications. But if you are careful and if you are on regular follow,
Hmm.
these side effects or adverse events can be detected in time,
Hmm.
and then they can be easily managed along
Right.
with the treatment. Yeah, so
All
there's
right.
nothing to be worried too much about, but you just
Hmm.
need to be aware of it.
Just a close watch need to
Here's a
be there.
close one.
Yeah. So, as we are coming to an end to this session, would you like to give a message to our viewers about this topic?
Yeah. So the message I would like to give that bowel symptoms are very common in patients, and we should not neglect your bowel symptoms. And if your bowel symptoms are too persistent or too discomforting, it is advisable to get it once checked with a healthcare provider. Maintaining a healthy lifestyle like regular exercise, proper dietary patterns, avoidance of too much of processed foods or uh, unhealthy eating habits, managing a stress-free life like trying to sleep on time, eat on time, and adequate number of hours of sleep, proper healthy balanced diet with all fruits, vegetables, fats, carbohydrates, protein, not focusing on only one type of food, can actually go a long way in maintaining a very healthy bowel. And a healthy bowel will keep you fit as a person. And yeah, so that is the advice I would like to give.
Okay. Thank you so much, sir. I'm sure this session has
Thank
really
you.
helped our viewers and, educated them about this disease. Thank you so much to all our viewers to be here with us today.
Thank you.